Hello, here's how I studied pterygium. Pterygium is a triangular fibrovascular growth of degenerative subconjunctival tissue over the cornea. This growth destroys the Bowman's layer and the superficial stroma. The cause of this growth is limbal stem cell deficiency. This limbal stem cell deficiency causes activation of matrix metalloproteinase. The clinical features are very easy to understand. You can understand this by this diagram. The site. First of all, this is the nasal side and this is the temporal side. It is more common on the nasal side. Then, as we can see on the diagram itself, that it is a triangular growth. The apex is towards the cornea. The apex is towards the cornea. Then there can be loss of vision. One more feature is Stocker's line. Now, what is this Stocker's line? Stocker's line is deposition of iron in front of the apex. Now let's see what it can cause. If this pterygium is just over the cornea, like this, it can cause corneal astigmatism. But if it is over the pupil, like this, it encroaches into the visual axis and therefore it can cause loss of vision. So it can cause astigmatism and loss of vision. It is associated with UV rays exposure, dust, and humidity. So we can prevent it by protecting the eyes from these things. Next is treatment. The best treatment is surgical excision. But surgical excision has increased rate of recurrence. So to reduce this recurrence, we use topical mitomycin C and we use autograft. This autograft is harvested from the same eye. Autograft is self-graft, right? It is extracted from the same eye. The site is usually superior and it is fixed with the use of sutures, fibrin glue, and autologous serum. That's all about pterygium. Look forward for more ophthalm videos.